Conrad is a senior vice president at As You Sow, an Oakland-based nonprofit where he engages companies using shareholder advocacy to improve their environmental practices. I'm wondering if that means shaming them. He specializes in resource efficiency, recycling, and producer responsibilities, led shareholder dialogues with Coca-Cola, Colgate-Palmolive, Dr. Pepper, Snapple, General Mills, Kraft. There's a whole bunch they're all in your program. The title of this program, or of this presentation, is Shareholder Pressure to Challenge Pharma on Drug Disposal. I'm excited to hear about this.
Hi, everybody. It's great to be here. Yeah, a little about As You Sow. For those of you who aren't familiar with it, we do shareholder advocacy, which means that we engage companies as shareholders in alignment with other green shareholders and socially responsible shareholders around the country, and that usually means getting together and having dialogues with companies about improving their corporate practices, specifically their environment and social practices. And if that doesn't work, we can file these shareholder proposals under the SEC rules that allow a vote at the annual meetings, and so we will push those, as we're going to talk about today here with the drug disposal issue, and then we urge some of our colleagues to actually vote their proxies. I've worked a lot in the past 10 years on recycling and recycled content and recyclability of packaging and products. And just very quickly, so you get a taste of what we do if you're not familiar, we've gotten commitments from Coke and Pepsi and Nestle Water, some of which are coming due very soon, to increase the amount of bottles and cans collected. And we're going to be making sure that they do that, or else there will be new campaigns on their behalf. We got a 30% shareholder vote at McDonald's a few years ago to phase out foam, and they did. And I'm not sure if they've done it totally, but and Dunkin' also around the same time has moved to phase out foam cups. So we're very pleased with that. We got a couple of commitments from big companies on reducing, making packaging more recyclable, and we got Colgate-Palmolive. It's going to phase out non-recyclable packaging in 3 of its 4 divisions, and the 4th division, which is the toothpaste tube, which has never been recyclable, they're working on that, and they're not sure if they'll make it, but they're going to try. P&G, very similar, is going to do 90% of packaging by 2020 to make it recyclable. But today we're going to talk about pharmaceutical waste, which is a big growing problem, and it's both an environmental problem and a social drug abuse problem. The story of pharmaceutical waste is really a story of waste and abuse, the waste of a significant amount of the prescribed drugs that go unused and are improperly disposed of, and the abuse of the unused or expired drugs by teenagers or others for whom the drug was not prescribed that were left in medicine cabinets. And you can see here that some of these statistics are mind-boggling, that about 2/3 of prescription drugs, their estimates, are unused, or about $5 billion a year in some cases. And the President's National Drug Control Strategy Report has said that a lot of this comes from the family medicine cabinet. It's a common source of misuse of prescription drugs. There's really no formal system for take-back. In the past, there have been efforts to urge people to just put them in the trash, and we'll talk about why that's not right in a minute. In the interim, the Drug Enforcement Administration has had collection events, and you can see in just 10 events around the country, they got 5 million pounds of drugs back. So clearly there's a need for a more stable and ongoing kind of take-back, and we believe this is a system of national take-back kiosks. Drug overdose is now, sadly, the leading cause of accidental death in the U.S., exceeding auto accidents. 47,000 people die every year from drug overdoses, and about 19,000 of that is related to prescription painkillers like oxycodone. Medical accessories like syringes and needles also need safe disposal options. 3 billion needles are used annually to deliver medications in the home. And the President's strategy, as I mentioned, calls for the establishment of disposal programs in communities, but the drug industry really has not led the efforts to develop them. And lack of disposal programs also impacts water quality. Many residents flush drugs down the toilet, and water treatment plants are not equipped to process the medicines. Now, EPA advises consumers not to flush the drugs, but to return them to disposal locations. Of course, there aren't many, so that's the problem. An AP study back in 2008 found that pharmaceuticals of every stripe, anticonvulsants, mood stabilizers, sex hormones, are in the drinking water of 41 million Americans. And so adding to that burden by just dumping drugs and flushing them is really crazy. So governments have begun to pass ordinances requiring drug companies to take financial responsibility for drug disposal, as I'm sure many of you know, following a decision last year by the Supreme Court to let stand a lower court ruling that rejected the contention that drug makers, that making them pay for take-back was unconstitutional. And as you may know, that played out right here in Alameda County, where that ruling has now set the stage for these ordinances that have now 7 have been passed in California, 1 in King County in Washington, and just last week in Massachusetts. I didn't know this until I heard about it. The whole state is going to be required take back by, and the finances are going to have to be done by the pharmaceutical industry. So that's really good news that there's momentum out there, I believe. So what we've done is focus on 3 big drug makers to file shareholder proposals with this year. We engaged in dialogue with them. They were not terribly cooperative or responsive. So onwards. And we've got AbbVie, Johnson and Johnson and Merck, 3 of the largest companies out there. And what we're asking them is to develop policy options for working with their industry peers to take primary responsibility for developing a national network of local take-back programs, and to determine, and this is the important part, to determine its level of financial responsibility. And AbbVie makes Vicodin, which is a widely used painkiller, hydrocodone combination product, and J&J makes Concerta, an ADHD drug, and an opioids fentanyl, all of which have been cited as among the most abused drugs. So we're right in the process now of mobilizing shareholders to support votes at these companies that will be coming up later this year. So far, the companies have avoided, let's say, the question of responsibility. They talk in general terms about shared responsibility, but none have really come forward to discuss what this might look like. Mostly, they're letting their trade association, Pharma, do the dirty work of opposing these new county ordinances while not providing a substantial alternative and generally minimizing the problem. However, the good news is just in the last couple of weeks, we have seen Walgreens take voluntary action by announcing they're going to put 500 kiosks in 39 states and pay for them. And what's really cool about this is that countering the companies saying this is unnecessary, Walgreens said prescription drug abuse continues to be a public health and safety risk, and that it wanted to address the 2 key contributors to the crisis, one of which is lack of disposal bins, and the other is access to naloxone, an antidote used for heroin overdoses. So Walgreens, the company, has said they think kiosks are needed. And as an example that you don't need to do this nationally, Lilly has funded disposal boxes in its home state of Indiana. They're based in Indianapolis, and they have put out grants so that pharmacies in Indiana can pay for, begin to pay for these disposal boxes. So what do companies say they should do? Companies mostly say that they should be educating consumers. But even their paltry efforts at educating consumers falls flat. When I started to work on this issue last fall, several company websites referred consumers to a program called Smart Disposal, which basically told consumers how to neutralize drugs by mixing them with liquids and with coffee grounds and then tossing them in the garbage. Of course, they didn't really address how, what happens if those coffee grounds ends up in your organics bin, spreading psychoactive drugs into your compost. That's another interesting question, but more fundamentally, when you try to access the Smart Disposal site, it had actually vanished. Apparently no one had paid to keep the website domain, and it was sold, and when you typed in Smart Disposal, you were taken to the new owner, which was a German site selling testosterone, which is somehow weirdly appropriate, I guess. You have the bulked up bodybuilder and the come on for testosterone. So what do we want? We're asking them to report on their existing policies, if they have any, to develop policy options, preferably a national network of take-back, and most importantly, to discuss the issue of financial responsibility. This is just another company that we think needs to get in line behind the paint industry and the electronics industry, the pesticides, and doing producer responsibility. Yes. So finally, I want to say we think the answer is this national network that will keep unused drugs out of the hands of people who would abuse them and reduce the potential for water pollution. Shareholders will be voting on these proposals in the next 2 months. If you own any of these stocks, or if they're in your mutual funds, please call your managers, urge them to vote. We're hoping for a 25 or 30% vote. Those are generally the size of votes that get results. And we hope there will be a wake-up call for corporate management and something that will lead to producer responsibility for drug disposal. Thanks very much.
You got this right on time. Stay here. We have questions. Folks have questions. Here.
Great question.
Repeat the question.
What happens to the drugs? That's a great question. Right now, as I understand it, the only approved solution or disposal is incineration. I hope that will change soon. I think one of the speakers later today is going to address actually research on that, so maybe there'll be some hopeful news. But right now, it all gets burned.
Oh, wait, we've got another question here. Yeah. What about hazardous waste? What? Oh, what if it was designated HHW?
Well, that's a good question.
Repeat it.
What about if it was designated as hazardous waste? I guess that could make it more eligible for federal funding options, but I still think from our point of view, in terms of bringing in it wouldn't probably change our approach, which is that we think companies need to take financial responsibility, but good suggestion.
Other questions? Oh.
Right, that's true. Some medical, some of it is actually so toxic, it is hazardous waste already, and it has special procedures. Right. In certain circumstances, it does already fall under the responsibility of the company for certain specific drugs to provide options, and they do have to provide mail-back secure containers with mail-back. Yep.
Oh, wait, here was another question.
Yep. Right. Yep. Right. Right. Yep. So she brings up a good point. Up until recently, for controlled substances like oxycodone, you had to bring them into the police station if it was a licensed, I think a Schedule I licensed drug. Fortunately, that DEA changed that law last year, and now, as long as they get licensed, pharmacies can take these materials in their take-back boxes, because they also found out a lot of people were not comfortable taking their drugs back to police stations, but pharmacies, they had no problem. So that's good news, but it does mean Walgreens and all these others have to go through the process of getting DEA licenses, and then they have very special, limiting, only the pharmacist can have a key and so forth, but that police issue is getting better because they changed the law.
Great. Thank you.
Thanks.